Good day, everybody, and what's up? Welcome to the podcast for Selfless Sex and She Comes First. I am Dr. Nick Myers. Today is Sunday, March the 6th, 2022. I'm going to post this on Tuesday, March the 8th, 2022, of course. And I hope everyone out there had a great day and a great week. And once again, thank you for all the support for the previous podcasts that I have posted. And I really want to jump right into this topic because today's topic is about antidepressants and sexual health, and more specifically, the sexual side effects that can come from taking antidepressants. Because many people may be unaware of these side effects and not really sure what's going on. And real talk, there are a lot of life stressors going on right now. There's a lot of social anxiety out there. There's a war going on, people just feeling like crap. And maybe you've been taking antidepressants for a little bit of time already, or you just got a new prescription, and you may have noticed some changes to your sexuality, and to your sexual health, and to your sexual desire, and wondering what's going on. What you may not know is that a certain class of these antidepressants are known to have strong and or severe sexual side effects. So let's talk about that today. According to the Harvard Medical School, the top 5 antidepressant medications are as follows: Celexa, Lexapro, Prozac, Praxil, and number 1 being Zoloft. And what's interesting is that they all belong to the same class of medications, which are called selective serotonin reuptake inhibitors, or SSRIs. And these medications work by increasing the activity of the brain chemical serotonin, which helps to regulate mood. Some of the more generalized side effects for SSRIs include headache, nausea, diarrhea, and having a dry mouth. And in many cases, these side effects wear off within a few weeks of starting the medication. And for other individuals, those same side effects will continue for as long as you are taking the medication. Now, with that in mind, SSRIs are also known for the sexual side effects, which may include decreased libido, decreased sexual desire, and difficulty with orgasm. And also, the researchers aren't really sure why and or how SSRIs affect libido. And according to Dr. Therese Malka at K Health, she says this, quote, "Though researchers aren't clear on how Zoloft affects libido, current theories point to how the medication's effect on the neurotransmitter serotonin can affect the brain's communication with other hormones essential for sexual arousal and sexual appetite." And just to paint a broader picture on how strong some of these sexual side effects can be for these SSRIs, additional sexual side effects can include delayed or painful ejaculation, difficulty reaching orgasm, penile anesthesia, where you actually lose the sexual sensations in your penis, decrease or loss of sensation in the vagina and or the nipples, pain during sex, and or reduced sperm count. Now, with that information out of the way, I'm actually happy to say this: all hope is not lost. There are things that you can do to help to manage the side effects, the sexual side effects of taking these SSRIs. And the first thing I have to say this too: not everyone who takes an SSRI will experience the sexual side effects. And at the same time, you may have a strong desire to make changes to the medications that you are taking. And my suggestion is this: please talk to your doctor first before you make those changes. Your doctor may want to, number 1, lower the dose. Or number 2, the doctor may want to switch you to a different antidepressant. Number 3, the doctor may actually want to give you another medication to counteract the sexual side effects you're getting from the antidepressant you are currently taking. Number 4, the doctor may want you to seek out therapy. The sexual side effects that you are experiencing may not be caused by the medication. So there could be something else going on which is causing you to have these sexual side effects. And possibly, number 5, the doctor may want you to stop taking the antidepressant medication. But before you make any changes, please include your doctor on any questions or concerns that you have before stopping this medication. And as I just said a second ago, your doctor may want to switch you off of an SSRI and put you on an alternative medication, which is known to work well for depression, and number two, which is also known to have fewer sexual side effects. So here are 4 medications that are known to work well and have fewer side effects: Wellbutrin, Remeron, Viber, Trintellix. And I hope I pronounced those correctly, but I want to say this again. They are known to work well with depression and also are known to have fewer sexual side effects. So in closing, I want to say this too. Many people are taking some sort of antidepressant nowadays, and I am actually proud of them for doing what they need to do to take care of their mental health. And at the same time, they may have been surprised by the changes to their sexual desire, their sexual appetites, and they weren't really sure what was going on. It's possible that they ended up blaming themselves, or they ended up blaming their partner, only to find out it's because of the medication, or it's possibly due to the medication that you were just prescribed and you did not know this stuff before, or now you do. So I'm going to say this to you one more time. If you notice any sort of changes to your sexual attitudes or sexual behaviors or sexual wants, needs, and or desires, and you started taking an SSRI, it could be the medication. I gave you a list of 4 medications, 4 alternative antidepressant medications for you to explore. But at the same time, before you make any changes, please talk to your doctor about this, because your doctor put you on that medication for a certain reason. So on that note, you guys have a great day. Stay tuned, and I'll talk to you soon.